A warm welcome to all our viewers to our series Natural Medicine. I recently had the pleasure and the great honour of having a renowned scientist with us, who's also head of the Academy for Research and Science at the University of Rostock. He's a Doctor of Computer Science and Dr. Med, so of Medicine, and he's here again today to go through very important topics with me. Welcome, Dr. Jordan Petrov. Hello, good day. Thank you very much. We recently did a broadcast on 5G and then briefly mentioned a solution that has to do with magnetism. And what was particularly interesting was that you explained this magnetic field ensures that I have an increased supply of oxygen in my body. And it's precisely this topic, oxygen in the blood, that I rarely hear from my experts here. And I want to talk to you about that again. Is it known in medicine that actually a lack of oxygen in the blood leads to weaknesses, reduction of ATP production, illness? Well, I have to say that the problem with oxygen is very well known in medicine. It's not that the medical professionals don't know what oxygen means. They know very well that oxygen stimulates the production of energy. And that energy resides in the mitochondria. In every cell, the production of energy resides in the mitochondria. Oxygen, hydrogen, bang. Exactly. Well, oxygen, hydrogen, bang, it's not that easy. But the same thing happens in the body. The food components are ultimately burnt as they would burn in the open air. Only the whole thing happens on the basis of enzymatic transfers. But in the end, it's the same. Sugar becomes nothing but energy and CO2 and water. So, energy, CO2 and water, that's why sugar is actually a pretty clean product. If there's too much sugar, there are side effects. But basically, when I burn protein, then harmful uric acid is produced as a byproduct. And as the name implies, the uric acid makes the tissue acidic. When I burn fat, everything's fine. Fat causes the burning to provide the double the amount of energy. That's good, but we do have a big problem with fat. The rest of the process in burning fat is ketone. Ketone is basically acidic. And this acid is actually the whole problem of fat burning. Because a diabetic begins with a hyperacidity of the body, and it ends in hyperacidity. It ends in a diabetic coma, and then in a diabetic death. And a diabetic coma means acidosis. It's an acid death. And that is what many nutritionists don't fix, don't discuss at all. So, if I burn fat, it's healthy, but only if I can catch the residual acid. That's why oxygen is always in connection with blood circulation. When you have poor blood flow, but the blood, wherever it goes, is saturated, the saturation is said to be good. But if the blood circulation is low, that's of little use. So in that respect, we say, well, I'll tell you briefly what kind of doctor I am. Well, I am a doctor who is absolutely convinced that the future of medicine is science. So somehow I might be a bit different from the naturopaths who call themselves naturopaths. I say science is the future of medicine. But in my practice, there's a sign that says naturally healthy. This is my guideline. And that means I use natural methods that are scientifically justified. And that's what I work with. I have to say that I am very successful. That sounds like self-praise. It's not good, but you can't get into the position you have now. I'm sorry, I have to say that, but it is a fact. Patients come to me from all over Germany. And when they come, they'll do a 3-day treatment. And in these 3 days, I have to care for the patients in such a way that they'll get for the next few years, if you will, a kick to survive the next few years, until they come up with the idea of coming to see me in Rostock again. And I have some special procedures for doing this. And the special procedures have a common denominator, which is more blood. That means better blood circulation. That means clean blood. That means better circulation with better quality blood. Yeah? How do I do that? So, the patients come to me, and I found out that they get this kick with a very special treatment that's only done by me. This is a liver treatment. So when I treat the patients, I treat their liver. And with that, I influence not just the blood flow, but the quality of the blood. So the machine that cleans the blood is being serviced first of all, right? Exactly, like that. A reset, something like that. You won't believe what I see when I do this. Yeah, you showed me photos, it was terrible. I get the liver to have a bowel movement, if you will. It presses out what is in it. And what's so special about this is that after 3 days, pale people get pink cheeks. Can you explain to me in 1 minute how you clean the liver? How do you do that? Well, the thing is, if you look at my pictures, yeah, you can't leave that up to the patient. I can't do that. If they do that, they absolutely need medical supervision. This all came out of this liver now, right? How did you do that? The huge things. So I mainly use foods and medicinal herbs that are known for causing the liver to empty itself with choleretic substances, so to speak. That's the secret. But all this filth has come out of the liver, what we saw in the photo. So the way we developed it, everything comes from the liver through the small passage to the intestine, and from there it's caught in a bowl in the toilet. Oh, God. So, the patient... But that gentleman was probably almost dead, or this person. That's insane. It's insane what comes out of it. I've been doing this for 30 years, and with some pictures, I went to see pathologists or anatomy professors, and we discussed how that is even possible. And that's why I say I only give prescriptions for alternative practitioners or doctors at some point. So this is nothing for patients to do themselves. Sure, but I understand in general the liver is rarely an issue in medicine. It just has an existence. It acts like a mother. It does everything and protects everything and takes in. Well, the liver is actually just like many other organs. But it is particularly important, and that's why I have focused on the liver. And if you consider, I have a statistic somewhere, 30% of the patients have normal liver values, but they already have budding fatty degeneration in the liver. It's become a widespread disease in medicine, and medicine thinks it's because people are fat. That's not true. So the liver doesn't get damaged and fat because people are obese, are fat. But the liver becomes fat because there may be poisons in the large intestine, very strong poisons, and alcohol are produced by mushrooms because environmental toxins enter that the liver can't handle. I got it. So back to your form of therapy. You're actually doing a service on the liver, pulling out the dirt. This has to be done in your practice, I understand. And so what's step 2? Step 2 is when the patients are with me, I prepare them to go home. I can't give them 20 infusions. I can do 2 infusions in 3 or 4 days. I have to prepare them for home. And there, for example, Parkinson's patients get an infusion, get a magnetic pad, which we'll talk about later, and when they get the infusion, so beforehand, they're so stiff and can't talk. They get the infusion, jump up and say, I want to sing and dance. So how uplifting do you think that is? For me too. What's in these infusions? Detoxifying agents. Again, so Parkinson's is a poisoning problem. And every time I meet a Parkinson's patient, I ask, how did you come into contact with wood preservatives so far? You know, I'm right with you. But on the other hand, I hear some people talking, you only need to swallow a little NADH, then you have more energy and then Parkinson's decreases again. But not the cause, and that's just, well, the cause is poisoning. I noticed that because I give detoxifying agents and the patient will then be sent home. And then they can continue to self-medicate. That's my goal. The patients have to treat themselves. But I also have an option for people who don't come to me. First, they get advice on what to eat, how to behave, how they have to protect themselves from electric smog, and then how to get more oxygen and cleaner blood. And these are again the Kleinsche magnetic fields, which are a solid pillar in my treatment. I'd like to briefly fade in and show a few more pictures. This is a university lab, University of Rostock. I went to this lab and we did tests there. The way the tests work is that in a double-blind experiment, I put my hands on it and there's a dummy somewhere. And somewhere there's a real sheet of Kleinsche fields. And after just 5 minutes, we can see the result. Yeah, that's very impressive. Here you can see that after 5 minutes, one hand has a much higher blood flow, right? It's definitely there. Although I don't feel anything. I go there unsuspecting. I don't notice anything. But the device, the thermal camera, registers a much greater blood flow after 5 minutes than with the hand with the dummy. What does it mean if I sleep on such a mat for 8 hours now? Will my whole body be as bright as your hand is here? No, it might not be the aim to illuminate the whole body like that. So, we haven't talked yet about how magnetic fields work. So, the polymorphic magnetic fields, so the Kleinsche fields, are passive, and they only react to movement. So only what crosses the magnetic fields will get an impulse over it. And if I cross it with a stream of blood there, and I wrote before, I heal you, it's transmitted one-to-one in the blood. So that certainly has no meaning, but it's good news after all. I heal you. And then electrical currents arise in the blood, which are comparable to the EKG. I did tests where I then simulated a flow of blood and then treated it with such fields. So the bloodstream will respond to it. The airflow reacts to this, so you have to understand it this way. I think you recently talked about fat legs on your show. I saw it by chance. So, sorry. The problem of fat legs is very complex. I agree, because the legs themselves play a role here. The heart, then the lymphatic system, the kidneys, and also the liver play a role. And consider, in this all-complex system, you said on the show, you have to adjust the omega-3, omega-6 ratio up or down. Yeah? But there's also a much easier way. You simply take a strip of Kleinsche-Fields and tuck it into the socks on the left and right in the evening. And overnight, your leg is suddenly slim. I have another photo here. Has it been done here, for example? That's one of those cases, where we have one leg on one side that still looks different from the other. And then you have, now put these fields. So the leg on the left was much more voluminous and had a lot more, we would call them efflorescences, these wounds. So the patient has had liver treatment from me and will now be in a few weeks. So, another example, a lot of people talk about high cholesterol. If the cholesterol is high, because the metabolism's wrong, that would be one side. But when I treated the liver, after 3 days, the cholesterol normalizes. I say it was just a blockage of the liver, and the liver can't get it out. It doesn't know how to get rid of it. Would that be an important message for the audience now? Anyone who has high cholesterol should think about doing a liver detoxification. Well, that would be too much for me. All I can say is that I can't treat all of them. That's all I can say. They can go to their own doctor and say they'd like a liver detoxification. They can't do that to them. I'm doing a unique therapy, not only in Germany but worldwide. But the fact is, the high cholesterol is caused by a hopeless blockage of the liver passages. That's my experience. I want to go back to this picture again. Here we actually see, so we put magnetic fields on this part where there was a problem, and the increased oxygen supply at these points has led to healing. The increased oxygen supply and the higher blood flow, more vessels are simply opened. Would we then have to work with such Kleinsche-Fields wherever there is a problem on a body in order to eliminate the problem? I can offer you a few examples if we have time. So it is true. That's absolutely true. And I'll tell you how. Some time ago, whenever I used the stairs, I felt a strong pain in my ankle. The pain was so strong that the leg immediately subsided as a reflex. That leg, and I almost fell. And now I say, that will likely always be the case with older people who fall because the problem isn't because they tripped. For example, you can find a patient in the garden and say, oh, they fell and broke their hip. That's not the case, I suspect. More likely, the hip broke at that moment and they fall because of it. That's how I see it. Therefore, I always, let's say, always believe that big problems should be dealt with when they are small. Of course, Caesar said that, or is supposed to have said that. So, big problems are solved when they're small. Therefore, people shouldn't wait too long with a treatment, but rather right at the beginning. What did I do? When I saw that, I immediately put Kleintje on it. Done. I fell. Now, that's a different story, so tripped. But now we're running out of time. No more time. I mean, you're 77 years old. You look really good and fit. I'm currently working on a theory, scientifically, at the same time I treat patients. And I have to tell you, as a physiologist, my blood pressure without medication, I don't take anything. My blood pressure without medication is 125/80. Like a young 20-year-old. I wouldn't say that, but for me, it's a signal that my blood vessels are elastic and free. And I can do that with these Kleintje fields by lying on them and sleeping on them. I was about to say that now. About 10 years ago, I let myself be examined, and my arteries had deposits of some sort. So that was a signal for me. When I treat patients against it, the doctor says, you can't turn that back. So now I have to treat myself. And last year, a Doppler examination was done again, and the result was that my arteries are pristine. In other words, I have proven with myself that arteriosclerosis can be turned back. And above all, in the background, I know it's because I've been sleeping on the Kleintje fields for 10 years. So they certainly contributed something very special, although I don't feel them. But I'll be happy if, at 94, I still don't feel the Kleintje fields. You just opened a new topic. We have to talk about arteriosclerosis. It's a very widespread disease, and we can't just tick off this case that you're describing. It's very important that we should still talk about this topic, about arteriosclerosis. Yeah, heaven's sake. Of course, if you want. We have to. So, conclusion and summary. In the first episode, we talked about the fact that you can have a wonderful protection with these Kleintje fields against electric smog, 5G, 4G, simply by increasing the oxygen supply by lying on this surface. I can sleep on it, I sleep well too. And the production of ATP in the body is increased. That means the self-healing and repair processes are there. There have been tests carried out in the lab with laboratory cells. The ATP production is increased threefold. But that's unbelievable, isn't it? People swallow NADH or Q10 tablets, just like those micronutrients, and orthomolecular medicine works on supply meticulously, vitamins, minerals, and so on. And suddenly, the fields show that everything is already there, and production is increased threefold. That is sensational. Without swallowing anything. You know, others are selling. A lot of money is made without a lot of adjustment of omega-3 and omega-6 ratio. And then all this rouleau formation in the blood, as I've seen it in the photos, that the oxygen actually tears this rouleau formation apart again. That means I have a very clean oxygen supply in my body. Yeah, that's right. And the cells are tearing apart because the cells themselves are getting more energy. And this increased energy causes a higher cell potential. And then they repel each other and flow properly again. Jordan, thank you very much. You're welcome. Really, to talk to a scientist who also knows a thing or two about medicine. We can all learn a lot at home, and I can too. And I'm very, very grateful to you for that. But I just see a great need that I just can't let you go today. No chance. We have to keep working because what you have to say is extremely important. Thank you, dear Jordan. And you, dear viewers, I hope you'll feel like me. This is where competence is located, where experience is located, where knowledge is located. 77 years old and he's still active as a scientist today in Rostock at the university and also working as a doctor with a successful way of detoxifying the liver and rebalancing all of the body's oxygen supply. I think it's just phenomenal. I wish you all the best. Thank you for watching. See you next time.